So, welcome everyone to our webinar, Live Well with Diabetes, Prevention, Management and Reversal. We are thrilled to have you join us today as we explore the vital strategies for not just living with diabetes, but also thriving despite it. Whether you're newly diagnosed, a long-time warrior in this journey, or someone seeking to prevent diabetes, this session will provide you with valuable insights, practical tips, and latest research to help you live well with diabetes. Our expert speakers will guide you through effective management techniques, dietary recommendations, and lifestyle changes that can lead to improved health and well-being. So now let me introduce you to our esteemed panel. We have joining us Dr. Saptarshi Bhattacharya, Senior Consultant, Endocrinology, Indraprastha Apollo Hospitals, Delhi. Welcome, Doctor.
Thank
We
you.
have
Thank you.
Dr. Amitabh Sur, Senior Consultant, Endocrinologist, Department of Endocrinology and Diabetology, PLS Hospital, and B.K. Roy Research Center in Kolkata. And we have with us Dr. Chandni Seth, Consultant Endocrinologist at Bhaktivedanta Hospital and Research Institute and Indira Group of Hospitals, Mumbai. Okay, so without much ado, let's start our awaited discussion. Dr. Saptarshi, first question coming for you. What lifestyle changes can individuals make to reduce their risk of developing diabetes?
Diva is a very, very important question. So, India, as a country, and it's a trend world over in the globe that the prevalence of diabetes is going up like huge. It's a huge epidemic or pandemic, whatever you want to tell. So, the numbers maybe were like maybe 20, 30 years back, the prevalence was like 5% or 7%. Now it's
Yeah.
going up to 10 to 14% or so. So, almost 1 in 10 adult individuals are having diabetes. So, uh, and if we look into the Indian population as such, so Asian population, Indian population, they are an ethnic group who are partly for genetic reasons, partly for unknown reasons, partly maybe for environmental factors. We are as a group predisposed to develop diabetes and
Okay.
other associated cardiovascular and metabolic complications.
Hmm.
So I think it's important that we inculcate healthy habits right from the beginning. So it has to start right in the childhood. So we need to be aware of what we are eating. We need to be aware about our physical activity, how much we are exercising, need to have proper sleep, need to avoid addiction. So all these
Yeah.
things are very, very important. So healthy eating habits should start in the childhood. And my son goes to school and he comes back and it's being taught that this is junk, this is not junk, and they are developing these habits right from the beginning. I think
Yeah.
that's the way to go about it. So you need to be careful, very, very right from the beginning, that you need to control your refined carbohydrate intake. So there should be less sugar in your diet, less
Yeah.
fat in your diet, maybe good quality protein in your diet, and a routine activity as well as some amount of physical exercise is necessary to prevent diabetes.
Right, absolutely. And I think out of all you said, the fact that you mentioned that some reasons are completely unknown is most scary of all. But since you mentioned diet and exercise, my next question for Dr. Amitabh is, Dr. Amitabh, how effective are preventive measures such as diet and exercise in reducing the likelihood of diabetes onset?
Thank you for this pertinent question, Divya. It is actually very important. The role of diet and exercise cannot be overemphasized. Diet, first thing first. So diet, both quantity as well as quality is very important. When we talk about quality, it should be a balanced diet, as Saptarshida has already said.
Yeah.
With fair representation of carbohydrate, particularly complex carbohydrate should get more weightage. Protein should get more weightage. Among fat, the quantity of fat should be limited, and among the fat consumed, saturated fat should be less.
Right.
Mono and polyunsaturated fat should get more weightage. That way, it will help in reducing the likelihood of development of diabetes. Regarding quantity, quantity
Yeah.
is even more important. The calorie amount is very
Mm-hmm.
important. For people
Yeah.
who are at risk of developing diabetes, for them, the calorie consumed should be almost equal to the calorie spent, or maybe little less, so that the patient or so that the person undergoes weight loss slowly. And that is also very
Okay.
important. Exercise is important. Both aerobic and anaerobic exercises are important. Both of them actually try help the patient to increase their insulin sensitivity and reduce their insulin resistance. And therefore, patients who are or persons who are at risk of developing diabetes,
Yeah.
they become more less likely to develop diabetes in future.
Okay, that makes a lot of sense. Dr. Chani, I would like to continue with you also on the same lines. Now, of course, Dr. Amitabh has explained to us, but then are there any specific dietary guidelines that are recommended for preventing diabetes?
Yeah. So sure, these are the similar things as mentioned by him. So the
Yeah.
guidelines emphasize on the increased usage of fiber in our diet. So fiber means all our salads, vegetables. He mentioned about carbohydrates. So the
Mm-hmm.
carbohydrates which have more fibers, like whole grains,
Yeah.
your brown rice. So things which have more fiber, you can say they have an ability to absorb your sugar and cholesterol levels. So if you want to prevent it, first is including more salads, veggies in your diets. Fruits also
Right.
contain a lot of fiber. Changing the type of carbohydrate, and your salt intake should definitely
Okay.
be less for prevention. In fact, when we see a diabetic patient, we have a plate method which we tell them that if you have a 8 inches plate, fill half the plate with salad and veggies. 1/4 is your protein and 1/4 is your grains. So that 1/4 protein, we want it to be a leaner protein. It could be your legumes or low fat dairy, your lean poultry and fish instead of high fatty things. As you mentioned, the fat content also needs to be low for an overall balanced diet. So these kind of guidelines are there for prevention as well as treatment for diabetes.
Okay. Now, Dr. Amitabh, what role does maintaining a healthy weight play in diabetes prevention and management?
A very, very important role. Despite the presence of so many risk factors, still obesity remains the most important causative factor for development of diabetes and also cardiovascular problem per se. So therefore, maintaining weight or BMI in the range which is appropriate for the person. For Indian people, we say that the BMI should be less than 23. Actually, 23 to 25 is overweight, and above that is obesity. And waist circumference also has to be kept in check. By waist circumference, actually we measure the visceral fat deposit of that person. So the waist circumference and weight both are important.
Could you tell us in detail when you talk about the waist circumference? Are there
waist
any
circumference
metrics
should be less than
that we
95
have?
centimeter waist circumference for our Indian patients should be less than 95 centimeter for the women and less than 85 centimeter for men. The higher the waist circumference, higher the risk of developing diabetes, higher is the risk of developing other cardiovascular problem, and so is the weight. And it is also true. It is not just true in a way to that maintaining appropriate weight and waist circumference will help you preventing development of diabetes or cardiovascular problem. But it is also true that for patients who are already living with diabetes, there also, if you can check your weight, if you control your weight, reduce your weight, reduce your waist circumference, then that will lead to reduction in the dosage of medication, reduction in the dosage of insulin. And if you are lucky and you are having diabetes of recent onset, and there are other factors which is beyond the scope of discussion here, then you may get actually reversal of diabetes also.
Okay, so there is a complete possibility of getting a reversal of diabetes,
and
I think that
is also true. There are so many other factors. I think that will be beyond the scope of discussion. But yes,
right.
Indeed, it is true for a percentage of patients.
For a percentage of people. So it is good news for the viewers, but of course they need to ratify it from their doctors. Dr. Chandni, can genetic factors be mitigated through lifestyle changes to prevent diabetes?
Yes, definitely. Because the common type 2 diabetes that we are seeing is a polygenic inheritance. So most common variety of type 2 diabetes is caused by lots of genes, and other than genes, a lot of factors. So what I usually tell patients is that maybe 50% of this tendency is there because of your genes, but the rest 50% is in your hands. So your lifestyle, your diet, your exercise, your stress levels, your adequacy of sleep, all these, if you keep in line, you can mitigate the genetic thing. Not all family members develop diabetes, right? So if your parent has diabetes, you should just take it as a warning or a risk factor and work harder to prevent it.
Right. So working hard is, of course, I think extremely important, and to make sure that we are doing that in every, circle of life, in its entirety.
Working hard in the right direction.
Yes. Dr. Saptarshi, how important is medication adherence in controlling diabetes? Of course, we've spoken about, all the other things, but medication is also a huge, has a role to play, especially people who already have diabetes.
Diva is a very, very, very important aspect of this discussion. So what we need to understand is that diabetes, it's a difficult disease. It's a disease which is going to last. So it's not like an typhoid or a malaria. You had your antibiotic and antimalarials and you come back, and after 5 days or 10 days, you were totally fine. So this is a disease. Most of our patients who have diabetes are type 2 diabetes.
Okay.
Type 1 diabetes is an entirely different arena. So it occurs in young children require insulin starting from their so whenever they develop type 1 diabetes. But the common type of diabetes will be type 2 diabetes. And what we also need to understand on top of that, it's a progressive disease.
Okay.
So many of our patients ask, Dr. Saab, my sugars are okay. Why do I need to continue medicines? So what we tell them is that your sugars are okay because you are taking medicines.
Right. So and I think as Indians, we have that mindset कि जितनी जल्दी दवाई छोड़ो उतना better. Get off medication. I think I'm sure you must be coming across patients who want to get who are in an urgency to drop medication.
So people do feel that अच्छा मैं दवा शुरू करो, that is why I will become dependent on medicine. So that is a very common psychology. So
absolutely.
Again, so it's not that if somebody comes to me with diabetes, I will start medicine for everybody right at the beginning. So in early stages of diabetes, if the sugars are not very high, maybe we can give it trial of lifestyle changes and exercises and diet for 3 months and see whether H1 is coming down. The H1 is a 3 months average blood sugar report, which is the key to glycemic assessment, whether it's coming down or not. So if it's coming down in the range where it should be, so maybe we can continue with that. But for most, continuing medicine is the rule. And sadly, it's not about continuing medicine. The diabetes is a progressive disease. So as time goes on, the insulin secretion in the body in type 2 diabetes actually goes down. So you start with one medicine, then after 2-4 years, it becomes 2. Then after 10 years, it becomes 3. After 15-28 years, it becomes insulin. So there are a few people who are very diligent with their lifestyle and diet and exercise, and genetic has a role to play in this. That whether you are how soon you are going to progress to a higher levels of diabetes where you will be requiring more and more medicines. So, but in most of the cases, if someone has diabetes, so continuing medicine will be the necessity. So it's a necessity where we actually can't help do much about it. So we will require medicines in most of this most of the patients with type 2 diabetes.
So it is not even an ideal case scenario; it's a necessity. And that is about it. And I'm sure you must be getting people who come to you कि डॉक्टर साहब बता दीजिए हम एलोपैथी अवॉइड कैसे करें? Can we do कुछ naturopathy कर लें? Can we do something else?
Yeah, sometimes people do tell, okay, I don't want to start medicine. I've never taken medicine in my life. So why do I need, my sugars is 250, but why do I want to start medicine? So the simple answer to that is if you are not starting a medicine today, so after 5 years or 10 years, you will end up with 4 more medicines along with some complications of diabetes. So starting medicine is about not only reaching the targets, it's about preventing long-term complications of diabetes, which is very, very important. So we are treating diabetes not to achieve numbers, not to achieve goals that the sugar should be this. So that has a purpose. That has a purpose that the person remains healthy for a long duration.
Absolutely. So I think this message has to go out to the viewers. When your doctor is telling you that please take this medication, the idea is to make you healthier and maintain your health levels and stop them from getting worse. Okay, Dr. Amitabh, what role does regular physical activity play in managing diabetes?
It's very important. Regular physical activity we encourage for all our type 2 diabetic patients. Aerobic exercises, which include walking, which is a very good aerobic exercise, should be done by almost all the patients, unless it is absolutely contraindicated for some or other reason. We generally prescribe that patient should do it at least 150 minutes in a week, divided in at least among 5 days. So 30 minutes per day should be the quantum of physical exercise or walking that the person should do. Along with that, we do say patient that they should take resistance training exercises, that is anaerobic exercises, for at least twice a week, 30 minutes for each slot. That should also be done. These exercises actually help in controlling glucose. It has been proven in several studies that HbA1c control with exercise is up to 0.8 to 1%, which is almost equal to any one oral hypoglycemic agent used in treatment of diabetes. But not only that, it also helps in reducing the insulin resistance and improving the insulin sensitivity and improving overall cardiovascular fitness for our patients. And that is also of pivotal importance.
Right. So, doctor, when you talk about walking, we do have this magic number which has been doing rounds for quite some time now, and that is 10,000 steps. What do you have to say on that?
So we say we don't generally step count is something which is not something which is textbook recommended. What we say that the person should do a brisk walk. And the brisk walk, the timing of the brisk walk should be at least 30 minutes in a day. It's not necessary that you should do it in the morning or afternoon or evening. Any time is a good time to do it. So usually,
and if you want, you can break it up into 10 minute windows throughout the day. Usually, the idea is that you put in those 10 minutes.
A rough approximate thing is that if you do brisk walking for 30 minutes, your step count is usually more than 5,000.
Okay. All right. Talking about steps now, Dr. Chandni, what steps can one take to prevent complications associated with the diabetes?
Of course, the first thing will be to keep keeping your sugar levels under control since the time it has started, because complications depend on one, how long you have diabetes, how bad it is or how good it is. And then there are other factors as well. So it is not just the sugar levels, but other factors like your blood pressure. So controlling your blood pressure to protect your heart, kidneys, eyes, your cholesterol levels. So many of our diabetic patients, irrespective of a normal cholesterol report, we start on cholesterol medicines only for the purpose of prevention of these complications. And of course, as everyone mentioned, that diet and exercise these will help in all these factors, whether it is diabetes, BP, anything. So this is how we can prevent the complications. One other important thing is routine monitoring of these complications, because just like diabetes, most of these complications, if you start having complications in your eyes or kidney, in the first stage, it is not going to give you any symptoms. So it's very important that our diabetic patients are routinely doing their eye checkups, kidney checkups, so that we can handle it at the early stage.
Okay. Dr. Saptarshi, we'll come to you now. Is it possible to reverse diabetes?
So, Diva, it's like the $1 million question. So, whenever you log on any social media, whatever account you have, so you are flooded with so many ads. They are all, and you even have ads. Actually, people and celebrities are claiming that, okay, I was having diabetes, but now I've started eating rasgulla. So again, the most important thing is that there is no magic where how you can reverse diabetes. There is
and all kinds of powders are being sold, and
so there is no magic way to reverse diabetes. So it's all about healthy lifestyle and how aggressively you are pursuing it. True. So first of all, if somebody is having diabetes for a very long duration, it's very 15, 20 years, has developed complications. So, and these people do ask because they are the ones who are having the maximum problems. They will come and ask me and I am sure Dr. Chandni and Dr. Amita will be also getting similar questions. Can't my diabetes be reversed? So 15, 20 years on insulin, the kidney has creatinine value for the kidney, which is a marker of chronic kidney disease, that has started going up. Maybe had an heart attack 15, 20, maybe 2 years back. So this person will come and ask you whether diabetes can be reversed. For them, the answer has to be no. But if somebody is young, has been diagnosed recently with diabetes, is slightly on the overweight side, and so that is the best window where you can actually work on reversing diabetes.
Okay, so you are saying weight is probably directly.
So if most of the studies in medical literature, what we have suggest that weight loss is associated with diabetes reversal. So how you achieve that weight loss, it depends on you. So it can be through lifestyle, it can be through calorie restriction, it can be through vigorous exercise, it can be through newer medicines which are coming up which can cause weight loss. It can be through bariatric surgery also, where you lose almost 20-30% of your weight. So you are weighing 120, 130 kgs, you underwent a bariatric surgery, you come down to 80 kgs, and you for the time being you don't have diabetes. But
that's not a long-term solution, but from the way you're telling me.
Here, what I want to reinforce and highlight is that this is the diabetes. Again, we started with that. It's a long-term disease. So not that even if somebody, so for diabetes remission, what we mean is somebody is off medicine and the blood sugars are in the non-diabetic range or controlled range. Okay. So if somebody is having a say HbA1c of 6 and is not having any medicine, so somebody might tell, okay, my diabetes is under remission. But if that person starts eating sweets, goes haywire about his lifestyle, starts having no exercise, so he gets back to a very very comfortable type of zone where he started with. So then it won't take 2 months or more than 2 months or 3 months to go back to where he started, and he will actually end up again with diabetes. So there is no magic. It's only about physical exercise, diet, losing weight, and maintaining that. So the idea is to be off medicine for as long as possible. But you should diet, and even if we are remitting diabetes, that does not mean that a lifestyle can be eased. So if that is the way, then actually diabetes will come back again.
Okay, and when you talked about the magic word, what struck me was discipline. I think the only way to go about is bring discipline into your life in totality. So these days, of course, we keep on reading about it, on all the social media handles.
Discipline, lifestyle, exercise, and weight loss, and maintain that weight loss.
Right. And of course, not only diabetes will be solved, there will be so many other positive effects that will come into your life.
Absolutely.
Right. Dr. Chandni, what will be your advice for newly diagnosed diabetic patients?
So this is the group which needs most aggressive intervention. So actually, we have had a long-term study called the DCCT trial, and it showed that if you control sugars at the time when patient was newly diagnosed, even 30 years later, irrespective of their future sugar control, they had lesser heart disease and lesser complications. So that is one of the motivating points that I give to every newly diagnosed patient, that if you work hard now, you're going to improve your future risk of complications. Secondly, as we are talking about reversal, so again, I don't like the word reversal, we use the word remission, because we're not going to reverse the process. As it is mentioned, it's a progressive disease. So you have developed type 2 diabetes means you have lost 50% of your insulin cells. So we are never going to reverse it or get those cells back till the technology that we have now.
Yeah,
so your process has started. Yes, you are newly diagnosed. You will most likely be able to control your sugars with diet, exercise. You are likely to go into remission, but do not forget that you have diabetes. Your 50% cells have been lost. Now, that lifestyle change has to be permanent, as you said, discipline. And this is the time that you make your numbers perfect. Of course, with time, you have to regularly check your sugars because sometime or the other, the age will catch up. Your insulin cells are going to decrease and you will be on a medication. So as already mentioned, medication is also important at that point because our target is controlling your sugar and complications. It doesn't matter if it is medication, if it is insulin. So I think that first time when the patient is meeting us, we need to give them all these information because they're already well read
And
on
I think
all the sites.
Right. And it must, of course, be fairly difficult for you because there is no other way. You cannot soft quote this situation and present it. You have to be as blunt and as on the face for them to realize that, it is really important to control this.
Yeah, and one of the things which I think we always miss out is something called as a diabetic distress. Once a person is finding out that they have diabetes, it's a big news to them. Like
and addition to the stress which is already existing.
So the psychology of a patient who is newly diagnosed. So I think that also, we need to be sensitive because we might be seeing hundreds, but for that person, it's a big diagnosis that, so that psychological support is very important throughout.
Absolutely. Okay. Now, Dr. Saptarshi, nowadays, a lot of young people are also getting diabetes. Now, that is something which was not really happening earlier on, and I think it's pretty scary. What do you think? What are the reasons that attributes to this change and shift in the age group of people who get diabetes?
So that is something which is really alarming. So somebody who develops diabetes at the age of say 70 years, so maybe another 10-20 years to develop complication. Somebody having develops diabetes at the age of say 20 and 25 years. So previously, young diabetes used to be mostly type 1 diabetes. Now it's not that anymore. So type 2 diabetes occurs even so after puberty. So type 2 diabetes occurs a major chunk. It occupies a major chunk of the number of people who are having diabetes, and that has obviously our lifestyle has changed starting from childhood, and we are genetically predisposed to diabetes. So it's part of combination of both. That those who the genetics genes are always there. So the genes they have not evolved over last say decade or last 4 decades. So but I think combination of genes, combination of environmental factors. Earlier the child used to go out and play in the evening. Now the child, if he gets time, he will play a video game.
Absolutely. And I think it's become a living room discussion. When families get together, parents are exchanging that right now I have confiscated my kids XYZ thing, and it's just a new norm. And it's difficult to push the kids from the couch that go play out in the garden unless you put them in a class or something.
So again, that becomes actually a challenge. So obviously environment has a major role, but again there is something called, so what we also see is that we have a lot of ladies who are developing diabetes during pregnancy, which is called gestational diabetes. And that also has an impact. So there are some changes which occur in the genes and maybe some genetic associated changes like epigenetic changes. So if a lady who is having gestational diabetes, she conceives, it's not that the baby is going to have diabetes right then. But those changes in the metabolic changes during pregnancy will
in the mother
the child to develop diabetes at the age of say 15 years, 20 years or 30 years. So it's a combination of genetic changes, environmental factors, something also called epigenetic changes, which can be partly that evolves during the fetal programming. And obviously as a whole, we are our basic tendency is we have a tendency towards diabetes among Indians and Asians. We can't deny that.
We can't deny that. Absolutely. Dr. Amitabh, what role do family members play in supporting a patient with diabetes to have a healthy life? Of course, we know in India, families play a humongous part. Nuclear families are there, but still a lot of not a huge chunk is still not staying absolutely alone, and everybody is connected to the families. What would you want to say there?
So they play an absolutely very important role, actually, whether it's nuclear or joint. Anyone who is accompanying or who is living with a person who is living with diabetes, that person's role become very important in ensuring compliance to the diet which the patient should maintain. There are good days and bad days in which the patient may not be compliant to the diet, ensuring compliance to other lifestyle modifications like walking, etc.
Correct.
Helping sometimes to break the inertia, especially when we are asking the patient to initiate on injectable treatments like insulin. There is a huge
Okay.
amount of inertia at the part of patient, and breaking
Right.
psychological inertia, in breaking that, role of doctor is important, but role of family member is sometimes even more important. Also,
True.
sometimes managing diabetes distress, as madam said, is very important, where sharing one's concern to one's family member help in reducing the distress level when the patient can talk out properly. And
Right.
also, in some category of patient where the patient is visually challenged or physically challenged, their assistance in giving insulin, that is also important. There also the role of family members come.
Yeah. Yeah. I think that is definitely something that we do not talk about. And you mentioned a great point. Inertia is something which probably has a huge role to play. But of course, I think a good takeaway from here is that we have to remember usually when somebody you see is healthy, there's a big chance that their entire family is healthy. And when you see somebody who's obese, there's a huge chance that probably the entire family, in many cases, would be suffering because the kind of food that is being made and the other habits in the family run through all the members. It's not usually just one person.
Yeah,
And
it's
if
true for metabolic diseases.
yes, absolutely. And if you're eating healthy, if you have a code of conduct in the house, everybody's going out and working out. I think it just becomes a part. Everybody's seeing that. One is getting inspired from the other. Kids are looking at the parents doing that, grandparents doing that, and I think that's a great way. It's. I think we are lucky. Indians are lucky to have families, and a great way is to hold hand and move together in the right direction. Dr. Chandni, there is also a lot of advice available on social media and social circle of a patient with diabetes. And I see you smiling there. And I know probably where you'll be going to. How much should one believe of what one hears on social media? And what should one do to authenticate it? Because you have health influencers these days, everything. Fashion is one thing, but health is another thing altogether.
I feel social media can be a good thing as well. It depends
Yeah.
on who is using it for what purpose. So I would just, request everyone to see whose advice are they listening to. Like you are
Yeah.
following a health influencer. What is the degree of that health influencer? What is the experience of that person? So if you look at social media, there are many podcasts by qualified doctors also. So
Right.
just look at, is that person the expert person, in that area where you can listen to their opinions, and not
Right.
just opinions or lifestyle. Then there is a whole thing of over the counter medicines or powders or gummies or drinks. So I mean,
Right.
no doctor can recommend these things because they have not been tested to show these results. Just because
Right.
20 people are saying it, doesn't mean it. Whatever medication or whatever we are giving to you has been tested on millions of people. Then only I will give it to you, and
Yeah.
everything has a side effect. There is no medicine or nothing that you are consuming, including the food that we are eating, that doesn't have a side effect.
Absolutely.
But at
Yeah.
least with the medication which has been tested in millions, you know the side effects, you can stop it, you can treat it. So I feel
Right.
like the only way to authenticate is that you visit your doctor and ask the doubts instead of relying on your neighbor or your health influencer, whatever. You
Right.
can, obviously, it is a good tool for spreading awareness, but
Of
to
course.
cross check before, changing everything, just ask your doctor, whoever is, an expert in that area.
Right. So I think a great takeaway there, listen or watch whatever you are watching, consume whatever content you are consuming, but take everything, especially if you have to apply it in your life, take it with a pinch of salt. Do go and visit your doctor before you take anything which is being advised by anybody else. Okay, Dr. Saptarshi, what precautions should be taken by a person with diabetes who's about to, who's undergoing surgery?
So I think that is a very, very important question. So
Yeah.
hyperglycemia or high blood sugar, so it increases the complications associated with surgery in a major way. So
Yeah.
there's increased chance of infection. There is increased chance of even heart attack also if your sugars are uncontrolled. So
Right.
it's very important that it's not only for surgery, but otherwise also you keep your sugars under control. And
Okay.
specifically, if it's an elective surgery, you know that somebody has to undergo a gallbladder surgery. He knows that gallbladder stone, and we actually try to control the sugars and then request the surgeon to go ahead with the surgery. And a surgeon also is more comfortable that way. The anesthetist also is more comfortable that way
Yeah.
because you are going through a situation which require it involves a lot of stress. So somebody is going to undergo an anesthesia, is going to be unconscious. So for some time, then there is a recovery process, there is a
Yeah.
healing process. So it's very important that we have people who have diabetes and they will come to you just for the surgery, and after that they will forget everything and start.
Okay, and they'll go back to their regular lives.
So the sugars will be just controlled for the surgery. That's not the way to do it. So it's your life, so you need to take charge of it. And it's obviously surgery can be an area where you get in touch with the doctor, you know what has to be done. But again, that knowledge has to be carried forward and to prevent long-term complications.
Absolutely. I think this has been a fantastic conversation. But now, before we wrap up, I would want all three of you to give us 3 mantras for a person to live well with diabetes. We can start with you, Dr. Chandni.
I would give one mantra: practice mindfulness. Whether you are eating, whether you're sleeping, whether it's stress, just be aware on what you are doing to the body. So that, and invest in your body and your health, and you'll get better returns in the future.
Yeah, invest in the right place, and that is yourself to begin with. Okay, Dr. Amitabh?
Maybe eat right, do right set of exercises as suggested by your doctor, and also take right set of medications.
Great. And Dr. Saptarshi?
So I will like to tell that there are 3 mantras. If it has to be motivation, discipline, and persistence. So first of all, you need to understand it's your health. You need to be motivated. Nobody else, no health talks, no influencer can do anything unless you yourself understand it. And this is a disease where you require discipline. And even if you're disciplined, try out lifestyle changes in a way where you can stick to. So
sustainability is very important.
You Josh and do everything and lose 10 kgs of weight, and you leave it and you again have a rebound of 15 kgs back. So that is not the way to do it. So motivation, discipline, and persistence. So these are the keys to not only deal with diabetes, but again, any long-term metabolic health issues.
Absolutely. So thank you all of you for joining us for today's webinar. We hope our viewers have found the information helpful and inspiring as they navigate their own journey with diabetes. Now, it is important to remember that living well with diabetes is not just a goal, it's a way of life and involves informed choices. And as we discussed, it informs support and empowerment as well. So we encourage you to implement the strategies that have been discussed in today's forum and to continue seeking knowledge and community as you move forward. If you have any questions or would like further resources, please don't hesitate to reach out. Together, we can make a big difference in living well with diabetes. Have a wonderful day. And once again, thank you, Dr. Amitabh, Dr. Chandni, and Dr. Saptarshi.
Thank you. Thank you.